bring in Dr. Diyaa Rachdan, a senior consultant ophthalmologist at Sidra Medicine, recently volunteered at a Gaza hospital. Doc, thanks so much for joining us. Against that backdrop of severe hunger in a conflict zone, how were you able to do your job?
Well, thank you very much, Sally, for having me on your program today. And yes, it wasn't easy at all. It wasn't an easy job. Seeing people who've been subject to a 12 weeks now, almost 12 weeks of complete blockade, following a year and a half of war in Gaza, following 17 years of blockade on Gaza. It is very, very heartbreaking to see all of these children that are more malnourished, all of these women and elderly. Just imagine how these could be. And, you know, with these figures that I've just highlighted, it is a real disaster that's going there beyond the words, beyond what we can see on our TV screens. Seeing that with our real eyes is a completely different picture.
As an ophthalmologist, obviously I would imagine working on injuries perhaps to the eye. Just tell us a little bit more about exactly what you were doing there.
So mainly it was dealing with injuries to the eye, as you quite rightly said, whether it is a fresh injury with foreign bodies inside the eye or around the eye, with traumatic cataract as a result of the injury itself, or with cases that have been on the waiting list for a long time, waiting to be operated on, but because of the ongoing situation, they were not able to have their surgeries, let alone the situations of patients that have got multiple injuries that are being operated on by different teams at the same time and doing the most important, most urgent, most critical first and moving down the scale, and whether it will reach ophthalmology case, it will reach the eye injury or not. And a simple example on that is a case that I was promised or I was asked to go in and help and repair an eye injury while they were having multiple other injuries. And unfortunately, that patient passed away on the theater table before reaching the stage of me operating on him.
Very, very traumatizing. You're dealing with patients who are also malnourished. How does hunger affect the healing?
I'll give you a simple practical example for that. Going to the blood bank over there and talking to the staff, they are telling you that everybody who's got, who's coming to donate blood, they will obviously have their hemoglobin tested to ensure that they are suitable and fit to give blood. None of the donors has got enough hemoglobin levels to donate, but yet that's the only available, blood donation. So they will come and donate, and they are hoping that they will give some assistance to somebody that's badly injured. In terms of any major operation, the recovery depends and relies very seriously on how well nourished the body is. So if we're talking about a seriously injured person or somebody who's got a major operation done to them, then in that case, if they are malnourished to start with, their recovery, the way and the ability, their immunity is dealing with any infection that comes, through the door is very bad, and the survival will be much worse.
Thank you so much for talking to us, Dr. Diyaa Rachdan. He's a senior ophthalmologist who's recently been in Gaza.